Hi, welcome back to Easy Ayurveda classes, and today we'll be learning the concept known as the trachea. Sorry for my background voice, some disturbance are getting, ignore that and study well. We'll move on to the concept that is known as the trachea. They mainly ask for the 5 marks this question. Trachea. For the trachea in Sanskrit we called as the Shvasa Nali. Shvasa Nali it has to come. Here it is there. Khanta Nadi means the term used for the cervical part of the trachea, means consider this is the trachea. So upper this part will be known as the cervical part for 3 to 4, and remaining will be considered as the thoracic part. So it has trachea is divided into 2 parts, that is Khanta Nadi and Hridaya Nadi. For Khanta Nadi, term used will be the cervical part, and for the Hridaya Nadi, the term used will be the thoracic part of the trachea. This will be the introduction for the 10 marks question. Now we'll move on to the modern view of the trachea. The trachea or the windpipe is a tube-like passage of air, means it is a tube-like which passage of the air. It is about 12 centimeter long, and 2 centimeter in diameter, like this 2 centimeter, and inside what is there no depth, that will be 10 mm wide. Lumen will be 10 mm wide. Next, anatomical position. It's located in the mediastinum anterior to the esophagus. First, esophagus will be there. Upon the esophagus, upon this trachea will be present. Esophagus, trachea, and upon the trachea heart will be present. Remember this location, it is important. It is situated between the larynx to 4th thoracic vertebra. After larynx, the trachea start, that is at the 4th thoracic vertebra. Its upper end is placed at the lower border of the cricoid cartilage level of the 6th cartilage. Lower end is at the 4th thoracic cartilage. That means upper end which is present, no, that is at the 6th cervical vertebra, and lower end what you will observe here, no, that is the 4th thoracic vertebra. Next we'll move on to the only important points I will be teaching, which are just like a revision for your exam times. Next point will be the cartilages of the rings. So between this trachea, this is the trachea, and you will be having some C kind of the rings. So these are 16 to 20 C-shaped letter or C English cartilaginous rings made up of the hyaline cartilages. So these 16 to 20 are made up of from the hyaline cartilage, are attached to the anterior and lateral side of the trachea. Means anterior means front side, lateral side means back side. Anterior to lateral side they have been attached. These rings keep the trachea always open. These rings helps in keeping the trachea always open. Posteriorly tracheal muscles is found, means anterior trachea this is present, so posteriorly tracheal muscles will be the present. Next, wall of the trachea, it is made up from the fibroblastic. It is the fibroblastic wall. Next, histology of the trachea. The epithelial layer of the mucus is made up of the pseudostratified ciliated columnar epithelium. This is important. Just write the histology of the trachea, then write it is made up from the pseudostratified ciliated columnar epithelium cells. Pseudo means which have movement, ciliated means which have cilia, stratified means they are straight, and cilia with present. Pseudo means slight movement, columnar straight with columnar, like this. Pseudostratified ciliated cells will be present. Next one is the important relations. The thoracic part is important relations are anterior, posterior relations. Anteriorly it is present with the mandibular arch of aorta and the left common aortoid. See, I said first esophagus will be second. After esophagus, trachea will be present. After trachea, heart will be present. If heart is present, no, their respective heart organs should be there. So you can just arch of aorta and left carotid artery, left carotid artery. This much will be much more enough. Next, posterior will be, as I said, esophagus will be present. Vertebral column, you can write mainly is esophagus, that is more enough. Next, you write the headline as the blood supply. Write as the arterial blood supply, venous drainage and nerve supply. Arterial blood supply by brachial branch of the inferior thyroidal artery. The branch which supplies the thyroid, no, same will supply for the tracheal artery. So you can write thyroidal artery. Venous drainage will be the left brachiocephalic vein. Nerve supply will be two types, that is parasympathetic by the vagus nerve and sympathetic by the ganglions, this much. Next, you have to write the clinical notes, because in Rachana exam they will ask the clinical notes only important. If you have written clinical notes, then only they will give the marks. Trachea may be palpated clinically in the suprasternal notch, means when two clavicle meets here, no, this is known as a suprasternal notch. At that place the trachea can be palpated. Cilia of epithelium beats upward during coughing, it pushes the foreign particles outside. That means trachea is made up of the pseudostratified ciliated columnar epithelium. So these cilia will push out the foreign particles which are enters in the body. So that pushing action is there, no, that only causes the cough. Causes the cough in the body. Next, clinical anatomy will be tracheotomy or incubation. When air Y is blocked and opening is made into trachea, opening is made into inferior cricoid cartilage. This process is called as a tracheotomy. When tube is inserted is called as a incubation, which tube is inserted into the mouth or nose inferiorly through the larynx and trachea. That means you just write the tracheotomy or the incubation. These both means something foreign particle is stuck which is not coming out. No, at that time they will insert some tube from the larynx to the trachea region to take it back. So this is only known as a tracheotomy and incubation. This much will be the video for the trachea, and in my next video it will be covering the lungs. If you like my video, please like and share, subscribe to my channel. It takes more effort for me to create videos for you, because morning hour I'll finish my classes, evening I'll go to my hospital clinic, and after that coming from the hospital, that is around 9, I make videos for you. So please consider that my effort and subscribe to my channel. Thank you.